It's very hard to open a newspaper these days without one or two articles describing the pressures faced by the NHS, and a lot of that concerns unscheduled or urgent care. It's not just in the emergency department where we hear stories of the pressures that are faced, but we're aware of the knock-on effects in terms of cancelled operations, people waiting for patients who have to be diverted while an emergency case goes through. So one of the ways in which modelling can help us is to track the different pathways that people are taking through the system and enable us to make better decisions in terms of managing who turns up in emergency care, but also how we handle the conflicts between emergency and non-emergency or elective patients going through the system.
Well, the NHS is in crisis because we've got an increasing number of people who are ending up in the unscheduled care system within a finite budget and with resources which can't expand, because we haven't been able to develop properly the systems and processes and care in the community that people will need. There are some areas where that work has been done, but it's not been universal, and I think if we're going to really do something of significance to ensure the NHS is sustainable in the future, we've got to tackle the problems of long-term conditions, frail elderly population, mental health in the community, rather than people pitching up in A&E, which isn't the best place, which is not really designed to deal with those particular problems and people.
Many of the problems relating to the emergency department are because people can't get into a bed, and actually the most recent report by Monitor mentioned this as a fact. One of the things that we found out was that people tend to plan for beds on the basis of an average demand. But in actual fact, people turn up in the emergency department needing a bed at all different times of the day. And what that means is that you have your average numbers of beds, but you can see very clearly that there are going to be times of the week when you don't have enough beds for that particular type of patient and those particular type of beds. We think that using simulation, which allows you to model that complexity in terms of arrivals by day of the week, hour of the day, type of patient, how long they stay, all of that variability is going to be a much better way for people to start planning their beds so they get the capacity right at the right time.
So what we're finding in unscheduled care is that people want to explore the connections between the community and hospital, how people flow between the two, what it is that's causing larger numbers than perhaps we would like to hit the hospital sector, whether it's A&E or admissions to wards, whatever it is. And what we're finding is that people want to explore how they manage those connections, those flows in a better way. So this model shows how one might want to or need to shift the skill mix of the community workforce over time in response to a range of underlying population health needs and indeed service redesign. And when you put that into a model such as those that we're developing and using with clients, just gives those who are commissioning and developing the workforce an indication of the direction of travel.